Time and time again, I have patients that tell me that they don't want to get their mammogram to screen for breast cancer because they are afraid it's going to hurt. Whether they heard this from other people, whether they read it online, or what have you, a big fear is whether mammograms hurt or not. So I'm going to answer that question today based on my own experience getting mammograms myself, but also my experience as a family physician who prescribes these to women almost every single day. First thing I will tell you is that how comfortable you are during your mammogram and how comfortable it feels depends on a number of conditions. I would say number one, your breast size does likely matter. Also, your breast composition potentially matters as well, potentially how dense your breasts are versus other. I would also say the skill of the technician who is performing your mammogram, that matters. There are some mammogram technicians that have a lot of experience and that have techniques and ways to help make it very comfortable for women, and that can be very helpful. I would also say your body positioning during mammography, and again, that has to do with how your technician performs their mammograms, how they position you, but how you are positioned makes a difference as well. I would also argue that perhaps the time of the month that you get your mammogram could make a difference too, especially if you are menstruating. Your breast could just in general feel more tender at certain times of the month if you are menstruating, so keep that in mind. And there are likely other factors that play a role in terms of how comfortable it is or not. But I am going to answer the question, do mammograms hurt? Those are some factors I wanted to give you. By the way, let me just show you a very quick clip of me getting my mammogram. I know you won't be able to see the full thing because I wanted to kind of cover my parts up, but at least you can see the machine and sort of how it works. Take a peek.
Stop breathing. You can breathe and step back and breathe in. We did it. It's over.
So that is my first mammogram that I ever got. I started getting my mammograms at the age of 40. You should talk to your doctor about when you should get mammography, your mammograms done. Okay, do mammograms hurt or not? Well, I'll be honest with you. They can be slightly uncomfortable. There is sort of a smashing or a pressing that the plates do, the mammogram machine. It sort of does smush your breasts. If you've heard that, that's not wrong. That's actually how one of the ways that it develops the image so that the radiologist can read and see if there are any problems. So there is some pressure and it can feel a little bit uncomfortable. Again, also depending on many of the factors I mentioned at the beginning of this video. But is it, number one, painful to the point that it's something that you should be afraid of getting? Absolutely not. Yes, it's mildly uncomfortable. It just feels like a sort of a pressing, but first of all, it's very, very short-lived. Like we're talking seconds. Doesn't last very long. Number two, it goes away as soon as they sort of release the machine. Number three, again, it's very short-lived. And number four, it's a very small price to pay to be screened for breast cancer. And remember, screening saves lives. Remember, we do a lot of things to our bodies, whether it's for, physical enhancement or otherwise, whether it's getting our ears pierced, whether it's getting laser hair removal or Botox or waxing or whatever things we might do that also may be uncomfortable. But many times we do them because of the benefit we get from them. And that's how I want you to think about mammography or getting your mammograms. Yes, it might be slightly uncomfortable. I wouldn't even necessarily call it painful, but uncomfortable but it's brief, and it's for, it's for a whole lot of good. And literally, mammograms save lives. So please do not be afraid of getting your mammogram. Do not be afraid at all. Do not read unsanctioned or unverified information online. Make sure you are talking to your doctor about your situation and get your questions answered. I want you to write in the comments, those of you who've gotten your mammograms, whether you are men or women, and I say men because you have women in your lives, so you could probably weigh in on this experience that people in your life have had. Talk to me and talk to the other people who are reading the comments about what your experience has been and what you think. Please also share this video with others because I want to make sure that women know that the uncomfortability that you might experience is nothing compared to the benefits you will gain. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Please like and follow my page on Facebook. For those of you who send stars, I cannot thank you you enough. Also, please subscribe to my Superstars group. That's for exclusive content on YouTube. Please subscribe to my channel. Click the little bell for updates. Also, guys, go to drjencaudle.com for exclusive content. Guys, I'm Dr. Jen. I'll see you soon.